Hello and welcome. You're watching FII. I'm Sonal Mehrotra Kapoor. Oxygen concentrators, something on everybody's mind right now. But how does it really help? Who needs it? When do you need it? And which one should you buy? At a time when there is black marketing going around of so many oxygen concentrators and a lot of fake products in the market as well, the next explainer will take you through all things you need to know about an oxygen concentrator. Now first, let's understand what is an oxygen concentrator and why is it so much in demand. That's precisely because unlike a medically sourced oxygen in industrial units, which are supplied in cylinders, concentrators produce their own oxygen, so no refilling and can easily be moved around as well. In fact, let's first give you a full demo that I did with one of the oxygen concentrators to understand how exactly it works.
So oxygen concentrators, everybody's talking about it, trying to get their hands on it, but even when you do, there is a particular way in which you should be using it. So I thought we'll do a quick demo for you to understand this in greater detail. So what I have over here is a very typical oxygen concentrator with a capacity of 5 liters. Now I have elderly people at home who've been using this for a while, so I'm just using this one for a demo. What you need will entirely depend on what patient, which category of patient it is, and so let your doctor decide really which concentrator you need. Now a few basics to look at once you have one. I've plugged it in, and then there are two key things. There are two filters that will come. If you're unboxing a new one, it will come with a set of filters. I've recently replaced this one, so it's absolutely clean. There is one over here. There's one over here as well. And then there is this bottle that needs to be filled with water. It has a maximum marker written on it. Ensure that you're not going above that because it needs a bit of bubbling. When I put it on, you'll know what I'm saying. So let's put it on now. Power button on. On the LCD over here, press it in. It's showing me the flow, it's showing me time if I want to fix one. Let's try it on maximum capacity. So 5 liters a minute. Now the minute I put this on, you see the bubbling over here has begun. That means it's now functioning. Then comes in place the all important cannula. You got to attach it to the bottle outlet over here and attach it nicely. Otherwise, it won't, the flow will not happen. Also the cap has to be jam-packed so that there's no air flowing out of it. Now what I have over here is a mask. A lot of times these oxygen concentrators come with a nasal cannula which can be used as well. Put this in, fit it properly. That's absolutely crucial because the thing is that you should be breathing in air only coming out of the concentrator, so there should be no outside interference of it. Now, why am I saying this is important? Because let's understand the mechanism really of oxygen concentrator. This machine essentially is drawing in oxygen already present in the air, squeezing it literally, purifying it further, humidifying it, and then giving it to you. So on an average, the room like this would have about 21% of oxygen. This machine sucks it in, purifies it, concentrates it, it goes to the humidifier and you have it. So the thing here to remember is that if you're using this for long hours, ensure that your room is nicely ventilated. There's constant flow of air. So your doors and windows need to be opened now and then. Also, the other thing to remember here is if you're using it on a patient of COVID who is seeing extreme fluctuations, if your oxygen levels, your oxygen concentration levels on your oximeter, if they drop below 94, a lot of these concentrators also cannot help. That's the time when you need to go to the hospital. So, and during the time you're waiting for the ambulance to come in, waiting to get a bed, etc., which is the reality of a lot of us here in the country at the moment, ensure that you do this along with proning. We've done a video for that separately as well. So if you sort of do sideways proning with an oxygen concentrator connected to you, that's when you really get the maximum output
from a machine like this. Also remember, these are the times when there are a lot of fake products out in the market. Do not fall prey to them. There is an OPI level that needs to be checked. I'll do an explainer telling you that. There are several other markers in a concentrator that you must keep in mind before falling prey to any of the fake products that are being imported from all over the world. So take an informed decision and stay safe.
Now, I know there's a lot of panic buying going on, but remember, an oxygen concentrator is helpful in several ailments. But when it comes to COVID, it can only aid a moderate COVID patients, those whose oxygen saturation levels fall between 90, 93, 94. It can be used in severe cases as well, but that's only to sort of bridge the time before you actually reach the hospital. Below 90, you definitely need a hospital, because in that cases, those severe respiratory distresses, it is necessary that you provide oxygen that is almost 99% pure, and an oxygen concentrator is not up to that job. Now, once we have established that, let's look at which one should you really buy and how many of them are in the market. Now, broadly speaking, there are two kinds of oxygen concentrators in the market. There is a portable unit and there is a home unit. Now, portable unit, as the name suggests, does not need electricity source, thus it can be carried around anywhere. A home unit needs a plug point like the one I just used. But importantly, home units give continuous oxygen flow, which is absolutely essential for COVID cases, while a portable machine has pulse flow, which mostly is used for chronic but stable lung diseases, meaning a portable concentrator has very limited role to play when it comes to COVID. So dealing with COVID, a home unit is a preferred choice. If you look at prices, well, a portable oxygen concentrator price is usually 3 times more than a home unit. Next, very important to remember while buying an oxygen concentrator is checking its OPI, meaning the oxygen purity indicator. And as the name suggests, it is the purity of the oxygen that the concentrator is outletting. It should not be below 87%. That's absolutely essential. The other thing that will be thrown at you once you go out to buy really will be the capacity of the concentrator. Oxygen concentrators will be available in 1 LPM, 3, 5, 8 and 10 as well. LPM basically meaning liters per minute really. Now, which one you buy should strictly be on the advice of your doctor. But in general, the advice is from the experts that for a small family with no senior citizens, a 5 liter at 90% oxygen concentration is a good choice, is good enough. But if you have 2 or more senior citizens in the family and it's a big family, then a 10 liter with 90% oxygen concentration should be good, as it can also support about 2 patients at the same time if the need arises. So keep these things in mind and make an informed choice. All right, on that note, let's introduce our panel. Very delighted to have with us our experts. We've got Prashant Sharma, Managing Director for Acer Biomedicals. We've got from Bangalore joining us Sunil Khurana. He's the CEO of BPL Medical Technologies, and very delighted to have doctors and manufacturers both, as that really puts in a gives you a full perspective on which way to go when it comes to these concentrators. Dr. Vikas Oswal will be joining us very shortly, and Dr. Datta is with us. She's the Director for Respiratory Medicine at Medanta. Dr. Datta, let me begin by asking you first, lots of questions when it comes to the oxygen concentrator, but apart from what I've just said, some of the key things that people should keep in mind according to you. If you can unmute yourself, please, ma'am.
Beg your pardon. So you certainly covered the basic, pointers of the concentrator very well. I mean, we are going through a phase now as pulmonologists. We have used oxygen concentrators in chronic stable lung disease for a very long time, years and years, COPD, ILD. This is the first time we've witnessed a situation where, everybody seems to be needing it at the moment because everybody is susceptible to COVID. So I think it was very important to point out that, it has its role in the home setting, but one should not forget that, when hospitalization is needed, then the signs are very important. Also important to point out that, 90% and above is good. One doesn't need 100% oxygen saturation. 90% with a patient who's reasonably comfortable at low flow oxygen is perfectly fine. When it falls below 90, it's fair enough. You did point out that hospitalization should be considered, or at least consultation with doctors and things like that. Because of the dire shortage of hospital beds, I think the domiciliary oxygen concentrator is being used by everyone quite effectively. People have got a handle on it. But very important to be in touch with medical teams, with doctors, and understand the limitations as well.
Right. Talking about limitations, and before I go to those actually producing it, lots of questions on that front as well. Are there any side effects maybe to using an oxygen concentrator for longer duration, something that people should keep in mind? Certainly keep yourself hydrated is one thing that is advised.
Yeah, no, absolutely. So I think hydration, good ventilation, these are essential things. They all work on power. So, again, power failure and things, people worry about that because we do have outages, and then what happens with oxygen supply. So many people keep a backup of cylinder, which is also reasonable. Excessive oxygen, if you need it, you need it. That's what we tell patients, that if your oxygen is coming below 90, you're breathless, you need oxygen. The fuel for the entire body is oxygen. So we do have to provide that. Over-oxygenation is a problem we face in specific lung conditions. Probably not so relevant in the COVID context.
Okay.
But yes, I think oxygen is a vital drug right now that we all need in the COVID scenario.
Good to clarify that. Also, a quick note over there, in the video and the demo that I did, I used a mask because that is what I had at home really at this point. Generally, these concentrators come with a nasal cannula that can be used as well. So you can again check what is comfortable to you, and also always take the advice of your doctor. Don't take this, even what I am saying is a given at this point at all. Let me bring in Sunil Khurana at this point. Sunil, first question. There is a lot of panic buying going on. As we speak, there are oxygen concentrators which are being picked up by Delhi police at this point because a lot of black marketing is taking place. If you can take us through some key things to perhaps separate a fake concentrator from a good one. Are there any telltale signs that people should watch out for?
Thank you, Sonal. Thanks for inviting me. See, it's very difficult to say which one is fake, which one is not. So what you should do is that you look at the brand, what you're buying. Now, some people are even putting false brand also. What we have seen is that, we have a 1 or 2 models. And now I see a couple of more models being floating in the market, which are with the BPL logo, which is not ours. So what I suggest is that if you're buying, there are 2 brands which are very popular, which is BPL and Philips. You should go to the site and see, what is the look of the machine and try to buy that one. That's the most ideal way. It is very tough to go and educate everyone, but, on our website, and everybody's website, the reputed companies, you will have those products being displayed. And that is what one should see and buy, or directly connect to these companies to procure it. I'm also very worried that a lot of spurious machines are probably coming. There's a lot of flow. And I also keep hearing that, higher flow, their purity comes down dramatically, which is very bad. Then you are not really, it's not the right product for you to use. So
the OPI is something you should watch out for.
Absolutely. You are absolutely right. And as Dr. Gupta said, this is fuel for the body. So this is so important that you get a right product. Your overall judgment, see the fit and finish of the machine, you will understand which is made, not in good quality, that you can probably judge. But best is to go to the sites of these couple of companies which are proper branded companies, or connect them, or connect their distributors who are recognized distributors. Like if you're buying from a BPL distributor, you are very assured that he's giving you a BPL product. Or if you're buying from Philips, you know that it is coming from them. So that's the advice I give.
Right. Let me bring in Prashant at this point. Prashant, these are checks and balances that you can keep in mind in ordinary situations. These are extraordinary times. People are ready to pay anything. People are ready to sort of, make the worst of the situation as well, sending people and selling them fake products, taking money up front as well. If you could just take us through the availability currently in the country, and if there are some, again, telltale signs that people should keep in mind when you're procuring them, something they can ask for. Is there a code per se, or something that you can verify on the website of the company to ensure that you've got the right product?
Definitely, as Mr. Khurana said, we should buy product from the branded companies. the companies who can provide good after-sales services, who have a good track record in the past. Second thing, when you say the fake products available in market, basically all these fake products, if we compare, if we go through with the technical literature of these products, we will find when we use these products at a flow rate of 5 liter per minute or 6 liter per minute, the purity goes down and down. So basically these are not the medical concentrators. When we talk about the medical concentrators, if we are using a product at a flow rate of 5 liter per minute and the product is having a capacity of 5 liter, it should deliver a oxygen which has a purity of 92 plus minus 3%. This is basically the standard. So as Mr. Khurana said, we should buy the branded products like Philips, BPL or our product is a biomedical. We have a ABM brand name there, right? So one more thing I would like to share at your platform, that a lot of questions came from the patients that we should buy a 5 liter oxygen concentrator or a 10 liter oxygen concentrator. As a seller, most of the questions, it comes to us that whether we should go for a 5 liter or whether we should go for a 10 liter. As Dr. Datta said, in 95% or more than 95% of the cases, 5 liter per minute oxygen concentrator is more than sufficient. But when we talk about particular severe cases of COVID, sometimes we need 9 liter, 10 liter or sometimes more than 10 liters also. In those certain conditions, you need to admit the patient into hospitals.
Right.
But
so let me get a medical perspective on this. Dr. Datta, if you want to come in on that one. How many liters is actually useful and for whom?
Yeah, I think Prashant is right that if we are talking about the home setting, you know, we are looking at low flow oxygen. We are looking at moderate disease. And as we said, bridging the gap for a severe patient to reach hospital. So 5 liters for the majority will be perfectly okay. And many, you know, this time, because again of the shortage of beds, the cohort of patients that we would have admitted last time, we're actually treating at home with oxygen and high-dose steroids and other things in the home setting. But again, yes, if your oxygen requirement is going up steadily, then home is not the best place. And then we just have to step up care to a medical facility where, you know, other things can be taken care of, because we have seen that patients can, you know, plummet. They go down quite precipitously as well. This time around, we're seeing that. And I think very important to be in touch with medical teams, therefore, and know when to escalate care.
Right. Dr. Datta, let me also then ask you this question, which everybody is really asking at this point, which is, at what point should you make a decision to buy an oxygen concentrator? Right? We're all vulnerable at this point till the time we actually, I know it's difficult, but just give us a spectrum maybe to try and understand this. Should we have one at home because we have some elderly? Should we have one at home because we don't know what will be the availability of bed at all? How should you take that decision? Really help us understand that.
Yeah, that's a very difficult question actually. And, you know, and we all discussed the problem of hoarding. You know, healthy young people who can afford it will just keep one at home. And then there will be no availability and people who really need it may not get it. So that's a challenge, but you can't blame anyone because everybody's susceptible, everybody's nervous about it. And, you know, you don't want to be caught out in a situation where you do contract the infection, you aren't well, but you don't have access to oxygen. Right. So I think definitely people who are vulnerable, it is very reasonable for them to keep an oxygen concentrator at home. I think people who have elderly parents, definitely, or any other comorbidity. Other than that, it's difficult to justify because, you know, yes, everybody's susceptible, but does everybody keep a concentrator and run the risk of more needy ones not getting it in this kind of a situation where there's so much shortage?
And can it be used for kids as well?
It can. See, children by and large in the COVID context, they get mild ill. You know, they will rarely reach a situation. If they do, then they need to be hospitalized for sure. But I think while I can't comment on, you know, pediatric cases, but our understanding is that children deal with viral infections, you know, far better than adults. It's adults who are struggling and who develop this kind of extensive pneumonia. But yes, concentrator can provide oxygen to, you know, any individual.
Can I help you maybe answer that question a little better? Would it be fair to say that the level of exposure in the house should perhaps be your deciding factor? If you have people in the family who perhaps don't have a choice but to go out, don't have a choice but to expose themselves. In those households, perhaps, will it make sense to have an oxygen concentrator on standby?
See, ideally, I think really everybody should have it. You know, this time, there are no definitions, no boundaries of this particular viral illness. Last year we had older, vulnerable people. We had a certain subset. This time we are seeing young, old, all alike, you know, as susceptible, getting severe disease, and we're just grappling with it, you know, in that. So if you put it that way, I think you can't, you know, everybody needs one then as a standby. So it's a difficult one. You know, in a country of ours with 1 billion plus, then how do you distribute resources to everyone fairly? So that is a challenging question. Maybe they won't have an answer.
I know. Perhaps, maybe if it helps, what I did at my home at least was we formed a little bubble between 2-3 families, and between them there was one procured. So in case, and they were not interacting with each other, so that in case the need arises, one can be used. But that's just one way really. There are no easy answers here. I totally understand that. And again, it should be a decision you're taking with your doctor, not by listening to us on television channels. I just want to put that out straight as it. Prashant, you were saying something.
Yes, Sonal, I would like to request on NDTV platform to all people that we should not go for panic buying. In actual, there is no shortage of oxygen concentrators. All good companies, they are well capable of delivering the goods to the patients on time. The problem is that the people are going for panic buying, and these oxygen concentrators are basically not going to be used to our needy patients. So if we keep on going for a panic buying, every time you will find a shortage of the goods in the market, and this people should stop basically.
Right. Prashant, I'm very happy to see a manufacturer actually say that. Okay, so all points to you for actually saying that right now, and I really hope people follow that as well. I finally established my line with Dr. Vikas Oswal as well. Dr. Vikas, we missed you during the beginning of the discussion, but just your thoughts really at this point on people are doing panic buying on oxygen concentrators at this point. What is your advice to them? Who should buy it?
The thing is, right now we all are running behind oxygen concentrators. Yes, suddenly there is a short in market, what we are seeing, but this short in the stock in the markets are not that less. But yes, because the demand has increased a lot, probably there are someone who is creating a problem over here. So who needs to buy oxygen concentrator is a very big question.
All right, we'll just fix that up with him in just a moment. Sunil, if I can come to you, also the maintenance of oxygen concentrator is not something a lot of people talk about, but if you've been using it constantly, or perhaps there is a concentrator which has been circulating between houses depending on the need really, the filters, how often do they need to be changed?
Can I just take up that question which even Dr. Datta was talking about, the need, and let me explain that piece as well, and then I'll answer this also. See, I'm just comparing two countries which are similar population, China and India. But their average age in China is about 7-8 years more than us. We are about 70, they're about 77, 78. I know that for the last 10, 12 years, China is consuming for their domestic market about 5 lakhs units every year. India has been doing only 30, 35,000. Now, in my view, in a time to come, most lungs, when you go for a 65 years plus age, lungs get compromised. And it is actually a home care device. It is not something, which is a very typical medical product. It's a home care device. And over a period of time, you will see this will be like a refrigerator. This will be like ACs. And how much it costs? It costs, we keep changing our cell phone. It doesn't even cost that much of money. So ideally, over a period of time, you will see that most households will have that. Now, coming back to maintenance, there are two types of maintenance. Filter you can clean after 2 weeks, you can just take it to the water, fresh water, and just put the tap water and it gets clean. So that's one way. But the most important is that you have a chemical here by name zeolite. Now, what zeolite does is that with the help of compressor, you push a compressed air through zeolite, and zeolite absorbs the impurity. So just think of your RO. RO has a candle. And over a period of time, you need to change that. Same thing happens for the zeolite also. Over a period of time, when your purity comes down, it is not that product has gone bad. You have to just change that particular candle, which is known as a zeolite. So that's probably for moderate use. In a 2 years time, you probably got to use that, change that.
All right. So very happy to hear that from all of you. Thank you all for your time. This has been quite educating actually. We hope we've been able to help our viewers making some informed decision at the end of this program. Thank you so much for your time. That's all on FII today. We'll see you again later. Bye-bye.